I've always had back pain my whole
Okay.
life, but in August in 2017, I had a pinched nerve, and that just created all kinds of issues down my right leg first. So I could hardly walk on my right leg. I did get two different sets of steroid shots. Did nothing.
Okay.
So I've been dealing this since August of 2017. I did go to another osteopath, and I liked him, but I needed something different. So I saw your name, so I came, and this will be my third time. And the last time you gave me the acupuncture, which was incredible. I slept so well last night. No back pain today. My left leg feels really good. My right leg, I'm still having some pain, but it was marvelous.
So rather than a traditional acupuncture approach, my Korean colleague taught me this, and what we're doing is Dr. Shin does a lot of anatomical based acupuncture in Seoul, and rather than going after traditional points, he's going after anatomical points, which is what we're doing here, to actually go right after the pain generators. And I found this to be quite successful in my practice. How are we doing? Getting better? Still a little bit there?
Yeah.
A little bit right there? Okay. So again, oftentimes I can feel the tight tissue, but then also sometimes I like to have that patient feedback that I'm on the tender spots, and there we go. Now we're getting into that point. Good. And what we're going to do here is, just based on some of the pain that she was having, I'm just going to move this leg. You just relax. Let me pick it up. Just relax. I've got you. Yep, I got you. Just nice and relax. Let the hip go. Let the knee go. Might be a little sore. We're actually just going to mobilize this hip a little bit with the needles in place. There you go. That's it. That's it. Keep that moving. That's it. That's it. Good. Good, nice and relaxed. There we go. How's that?
Oh yeah. Better.
And here? Not too bad?
Not too bad. Nothing compared to what it was.
Anything here? No?
Still better.
Much
Night
better,
and
much
day.
different, much
Yeah,
different.
Yes.
Yes, good. All right, well, I'm going to help you sit up, and then we'll just talk to the camera briefly about what you're feeling, and then we'll do the other side, okay?
Okay.
Well, there you go. Feeling okay? Good. Go ahead and stand up, and let's see how that's feeling.
Not quite the wow as the other
Yeah.
side, but oh my.
Yeah, so how's that feeling? So literally you just
much
stood up from the
better.
table.
Yes.
Yeah.
Because I was having a little bit of pain down in
Yeah.
here. It's already.
Yeah, and so really, you know, we literally just took the needles out and helped you stand up, and this is what we have.
Yeah.
Yeah, so it makes a huge difference. This Korean style of acupuncture works very, very well. Like I say, this wasn't planned. You know, we saw you yesterday. We didn't
Yeah.
work on the hip. We worked in the
Yeah.
low back.
Yeah.
We were still having some difficulty with the right leg, and that took us, what, 10 minutes, 10, 15 minutes to do. And so what we're going to do is we're just going to pause the tape for a minute, and we'll get you positioned and work on the other side, and then we'll be done for today, okay?
Okay. All righty.
Hi, I'm Dr. Dan Williams, and I'm an osteopathic physician located at 135th and Meridian in Carmel, Indiana. My phone number is 317-819-4949.